determinants of health within a public health context. And part of the rules of engagement today is for the candidates to try and stay clear of anything that's specifically clinically focused or around medical or medical health issues. So that's rule number one, that we're going to keep this firmly focused on public health and broader public health issues. Obviously, attendees and candidates are all encouraged to be respectful to each other. So we're really hoping that people play fair, that they are respectful. We don't want any heckling, no sledging, etc. So please be fair in the way that you respond. To distill that down, the people here today and that are online are really interested in the policies and strategies that the candidates are going to uphold if they were to be elected, and that's what we're interested in. Each candidate will have 3 minutes initially to introduce themselves, to talk specifically around their policies and strategies regarding public health. And then we'll go into a series of 4 questions, and each candidate will have 2 minutes each to respond to each of those questions from their perspective in terms of what they'll stand for if elected. And then to finish up with, each candidate will have 30 seconds to ask one other candidate a question, of which that one other candidate will have 30 seconds to respond to. We do have, Marita's kindly going to be doing the timekeeping, so thank you in advance, Marita. And I do ask people the candidates to please stay on track from a timing perspective. Just to let everybody know as well, each of the candidates received the prepared questions on April the 17th as well, so they have had time to have a bit of a think around how they're going to respond to each of the 4 questions that we will be asking today. As I mentioned before, some of those key questions that people have submitted, we can't ask them all, but to give you a bit of a flavour, some have been asking around how will the candidates advocate for the health needs of Solomon. There's certainly been multiple questions that have been submitted around priority populations. We've had some around transgender youth and adults. We've had some around Aboriginal and Torres Strait Islander health advancement, including specifically questions around rheumatic heart disease and men's health. We've had questions around whether the candidates support the National Centre for Disease Control, and we've also had some generic questions around how are they going to ensure that their work improves health outcomes. So all that said, I'm now going to briefly introduce each of the candidates and bring them up to stage. We do have chairs behind here, so I'm assuming that the screen is going to raise. So as I read out the candidates' names, if they can please come to the stage. So we've got Mr. Ben Craker from One Nation. We've got Mr. Luke Gosling, IAM MP for the ALP. We've got Mr. Jonathan Parry from the Greens, and we've got Mr. Phil Scott, who's a community independent as well. We do also have Lisa Bayliss joining us. She, we have been told, is running a few minutes late for a good preventive health reason, so I'm told. So what we're going to do is I'm going to get Marita to come and draw the order of presentations today. So we've got Ben up first. We've then got Jonathan up second. We've then got Phil Scott. And then we've got Luke Gosling, and we'll leave Lisa for last when she arrives. So 3 minutes, over to you, Ben, to start the proceedings for today.
You want me to sit down?
No, you can do it from the seat with your hand mic, all good. And just reminding all the candidates again, Marita is timing. Timekeeping. Yeah, go for it.
G'day guys. Thank you for having me. I'm not originally from the Northern Territory. I'm a blown from Mackay, Central Queensland. I came to the Northern Territory 10 years ago, and I intend to spend the rest of my life here. I grew up in Housing Commission. My father was a single dad. This is a topic which resonates closely to my heart. My parents were both hardworking. My mum is still a cleaner today, and my dad is a middle income worker. I had the advantage of growing up in a loving community, a safe community with ample green spaces. I could be a kid. I could be home by dinner at 7 p.m. and there were no issues with that. The subject of childhood poverty really does resonate with me. I want to focus today on preventative health, on childhood poverty and the injustice and the scourge that it is on our society. Homelessness, mental health struggles have all touched me dearly, whether it's through close friends up here in the Northern Territory or with family members. I've seen the devastation of alcohol, drugs, suicide, gambling in the community. I'm very passionate about these subjects. I really want to see change. I've been 5 years sober of alcohol. I was a problem drinker when I was younger. I recognise that. I went cold turkey, and I've never been better since, and I want to look at the issues that are confronting Territorians through a fresh set of eyes. We do have a big problem with drinking in the community. It affects everything and every facet of our life. I think it's appalling that we have alcohol, gambling, advertisement on television, where children are witnessing this, whether it's through Snapchat or YouTube or Facebook. I think it is an absolute scourge on our society, and I want to see that changed. On the topic of ultra-processed foods and fresh produce, I think it's a right of every Australian that they have access to affordable produce, and we have to ensure that the food that we're selling our children is nutritious, affordable, and they are not exposed to relentless advertisement from these big corporations. I'd like to highlight that we should follow the money to see where our policies are being dictated and how money is influencing politics. Thank you.
Thanks very much, Ben, and thanks for showing respect by sticking to time as well. Our second speaker today is Jonathan Parry. Did you want to stay there or come up?
Happy to stay here.
Okay, not a problem. Go
Thank
for
you.
it.
Is this on? Yes. Yep, okay. Ready? Go. Good morning, everyone. Hi, my name is Jonathan Parry. I'm the Greens candidate for Solomon. I'd like to start by acknowledging that we're on the unceded sovereign lands of the Larrakia people, and I pay deep respects to their elders past, present, and to the emerging future leaders, which is the children. That's why we're here. That's why we're talking about preventative health, public health. It's about the kids. This election, the Greens are bringing a full suite of comprehensive policies to address the issues facing everyday Australians. We want to get free GPs. Labor have introduced policies that don't go nearly far enough and won't be implemented nearly soon enough. We want to get dental and mental into Medicare because dental health is preventative health and mental health is preventative health. Just last week, we announced a policy for free school lunches for public school children because kids can't learn if they don't eat. And it's one less thing for parents to worry about whether or not their kids are getting a full belly of healthy, nutritious food. The Greens have a policy to make price gouging illegal, and that includes in supermarkets. Because you shouldn't have to choose between having a full shopping cart and keeping a roof over your head, because we know that we're in the middle of a housing crisis with rents going through the roof and there being no protections, no controls for people, and a lack of housing is a cause of many preventative and chronic health issues. So we have policies for renters, first home buyers, and those facing mortgage stress, because stress is the root cause of so many illnesses and so many diseases. We need to stop new coal and gas. There have been 32 new coal and gas, 33 since yesterday, new coal and gas projects opened in this last term of government. And with Darwin being the city with the worst pollution in the country, we shouldn't be adding fuel to the fire. We need to invest in Aboriginal community-controlled health organisations. I'll be saying that a lot today because the solution for communities rests in communities. And finally, on gambling, we need to actually address these because gambling destroys families, it destroys communities. My background is as a legal aid worker, and I can't tell you the extent to which health issues, gambling issues, poverty, endemic poverty here in the Northern Territory, flow into the justice sector. And it becomes a revolving door with no one brave enough to do anything about it. Thanks, everyone.
Thanks very much, Jonathan. We'll hand it over to Phil Scott now.
Thank you, James, and good morning, everybody. I'd also like to acknowledge we're meeting on Larrakia country. This is land that's never been ceded and treaties haven't been signed over it. I'd also like to acknowledge that the Larrakia people have looked after the health and well-being of this land, of the waters and its people for generations. I pay my respects to their elders past and present and acknowledge First Nations people who are here with us today. I also commit to working to truth, justice and treaty. I commit to listening to Larrakia families, first and foremost, about the solutions they want for their community here in Garamela, Darwin. It's a privilege to be standing here as the first community independent running for the seat of Solomon. I believe we have a genuine chance to do things differently, to bring a new kind of politics to the territory, one that listens, respects and puts people first. This is what hundreds of people from across our cities of Darwin and Palmerston are engaging in. Too often we are having public policy decisions made for us by others from elsewhere, thousands of kilometres away, without the opportunity to actually input into the sorts of policy settings that affect us. The community's told me what they want. Less party bickering, more action, less spin, more substance, and that's what I'm here for. I'm also interested in real positive change for Darwin, Palmerston and all of us. Most importantly, I feel strongly about evidence-based decision making. That means listening to locals, like many of you here, who work in public health, education and environment protection. I want the data to shape our direction, not the interests of corporate donors to political parties. When it comes to health, our most basic human right, we are failing. Right now, our health system is stretched and prevention is almost missing from the national conversation. We spend around $250 billion a year on health, but only 3% of that goes towards preventing illness in the first place. This is an ambulance at the bottom of the hill approach to public funding. Whenever there are public discussions about health, it invariably comes down to hospital beds. We need more imagination and more consideration for community interests. We need to invest in keeping people well in housing, education, mental health, good food and early screening. These are the foundations of strong communities, the things that make a difference in people's lives long before they ever reach a hospital. We can have a strong economy and healthy environment. And this means investing in local businesses and entrepreneurs, backing renewable energy and saying no to short-sighted polluting mega projects like Middle Arm. Thank you.
Okay, and thank you very much again for sticking to time there. We're now going to go on to the suite of questions that we have. As I mentioned earlier, we've got... Oh, sorry, Luke. I'm sorry, Luke. I'll pay for that one, I'm sure. Go, Luke.
At least I turned up, mate.
Yeah.
We all had the ability to be at pre-poll this morning when there's that little morning rush, but we decided to come here and speak to all you fine folk as well. I want to acknowledge all of you, particularly the public health and all the members of our professional health community for the work that you do. I acknowledge the Larrakia, and right out that window is where last elections, my number one commitment will be built. And that was $11.8 million to a brand new Danila-Dilba Health Clinic. That land, as of last week, after a bit of a period of trying to get it established, will be a brand new Danila-Dilba Health Clinic. So working with First Nations communities is obviously incredibly important to us as an organisation. That's why we've created urgent care clinics around the country, mate. Well done in staying sober. Well done on having policies. We don't always agree with the Greens on policy, but they have policies and they're passionate. Let's talk about doing. Who does things? There's an urgent care clinic not far from here that's seen 21,000 people free that otherwise may not have sought health care. We're going to build an urgent care clinic in Darwin as well. Bulk billing was smashed by the Libs, CLP. Accessibility and affordability of healthcare is obviously really important. Just to give you an idea of, because it's actions, not words, of some of my background. When I left the army, I started a charity in Timor-Leste, and we focused on maternal health care because it's some of the worst maternal and infant morbidity and mortality in the world. And there was a modest improvement during the time that we were working on those programs with our partner Timorese organisations. But back here in Australia, I established the federally funded remote area health course. So that was getting doctors, nurses, allied health professionals out into the communities of the territory and trying to make a difference by tackling issues there. But we all know the social determinants of health. So housing, $4 billion deal between the Commonwealth and the NT government to build more housing out in the communities. That's really important. But education, bringing up our kids. That's why I've committed $5 million to a early childhood education and care centre in Karama, one of the lowest socio-economic areas in Greater Darwin. That's important, not only for the kids, but for the parents. We know the brain development happens in those first 5 years, so all that's important. I think we've done some good stuff in the gambling space, but there's more to be done. So after I work with Vinnie's as well, I'm still a volunteer with Vinnie's, a great organisation. But again, that is working with people at the grassroots and trying to lift them up out of poverty. That's time. Thanks very much.
That is time. Thanks very much, Luke, and apologies again for skipping you there. We will now move to the questions. As I mentioned before, 4 questions. We'll go from this side across, one at a time, 2 minutes each. So the first question is, given the increasing heat and impact on people in the NT, what is your position on the NT expanding fossil fuel projects? So over to you, Ben.
First and foremost, I hold deep concerns about the proposed development at Middle Arm. It's unacceptable that volatile organic compounds will inevitably lead to children being exposed while they're playing in their backyards and in our green spaces. We have to ensure that our children have clean air, plenty of access to green spaces like parks and bushland. We don't want to see Darwin become like the Cancer Alley in the Mississippi Delta in the United States, where overwhelmingly lower socioeconomic communities are impacted by such developments. For example, there are raised cancer rates in neighbouring communities, which are overwhelmingly disadvantaged. These developments will affect these communities, and we oppose it as it stands. I support offshore gas, providing that it meets strict standards, located away from critical ecosystems and places of beauty. As for fracking, I do not support it as it currently stands. Most Territorians oppose it. We have a lot of questions in regards to the management of the toxic brine sludge and how we're going to dispose of it. It's unacceptable to propose that we discharge this water into ancient aquifers. These aquifers feed ancient wild rivers and are important to our traditional owners in their way of life and the territory way of life. And first and foremost, why aren't we getting this gas for free? You know, this development has gone ahead, but we are not capitalising on the gas and utilising it here in the Northern Territory for cheaper power generation and manufacturing. Thank you.
Thanks very much, Ben. Luke, over to you now. What is your position on the NT expanding fossil fuel projects?
First, just want to pose a question to you, but what is the alternative? And the alternative is, obviously, Peter Dutton-led... The alternative is a Peter Dutton-led coalition government, and they're going to oversee the CLP NT government's management of land, water and development. Just ponder that for a sec, what that's going to look like. The other alternative is obviously an Anthony Albanese-led federal Labor government who has put in a water trigger into legislation to make sure that if there are concerns, which there obviously are, and I'm concerned, we're concerned about damage to water. Tanya Plibersek has got an expert scientific advisory panel that is looking at every aspect, every claim that comes to her in her capacity as Environment Minister of Australia to assess any damages. That's with the exploration that's happening. But the water trigger is in there for a reason, and we deliberately put it in there to make sure that if there is going to be damage to the water table, that can be assessed and action taken if required. When it comes to middle arm, I think there's been a lot of misinformation about middle arm. Middle arm has sort of become a dirty word. Sustainable Development Precinct. My focus is on renewables. I work a lot with Sun Cable. We're putting big batteries out to make solar and renewables work better. We've got a lot of sunshine in the Territory. We're not only using that in record numbers for our homes with batteries, discounted batteries, that's one of our policies as well. But we want to make sure the environment is protected. But only federal Labor will protect the environment. And what is the alternative? It's the coalition in government and the CLP running roughshod over any environmental protections at all.
Thanks very much, Luke. Jonathan, we'll now hand it over to you. What is your position on the NT expanding fossil fuel projects?
Yes, the question was, what is the position on expanding fossil fuels? I can tell you with complete conviction, we're completely against it. As I said, there have been 33 new fossil fuel projects opened since Labor came into power, including the final approvals being given to the Barossa fracking climate bomb yesterday. This is entirely unacceptable. It's unfathomable that we're having a conversation about middle arm in 2025. The business case does not stack up unless it's pursued as a dirty petrochemical plant. We know that health outcomes for people who are in proximity to petrochemical industry have massively increased rates of cancer. Is that what we want? I think not. This is a forum on public health. I would suggest that stopping new fossil fuel industries, stopping new coal and gas is what's needed to help the health of people in the Territory, people in the country. We know that we've got enough gas. We're sending gas overseas to on-sell for profit, and that's ridiculous. It's lunacy. In a wealthy country like Australia, we should be able to invest in renewables, diversifying our energy industry so that we're not continuing to dig up dirty coal and gas and heat our already warming planet. We know that as the world gets hotter, there's going to be more heat stress, there's going to be more impacts on people who are the most vulnerable, and to continue to open up fossil fuel industries is unacceptable. In terms of middle arm, that money should be reinvested into services that people actually need and to upgrading our systems here in the Northern Territory so that we can climate-proof our future. Thank you.
Thank you again for keeping to time. We will now hand over to Phil Scott. What is your position on the NT expanding fossil fuel projects?
Yes, also very happy to answer the question. I don't support the expansion of fossil fuel projects in the Northern Territory. Our community is if we value evidence-based decision-making, we have to acknowledge that the Intergovernmental Panel on Climate Change and the United Nations are telling us that to keep global temperatures below 1.5 degrees Celsius, we cannot open any new fossil fuel projects anywhere around the world. As Jonathan said, we've opened 33 of them. Our community is on track to be uninhabitable by the end of this century. We need to take this seriously, we need to acknowledge the science, and we need to understand that that means heat stress. That means a lot of preventable deaths that are dependent on the decisions we make now in the 2020s. This heat stress worsens existing health conditions. All the evidence shows that climate change is real. When it comes to these gas projects, it's one thing to introduce legislation that brings in a water trigger. It's another thing to actually apply it. We need to be able to assess the impacts of these projects on human health and environmental health. We're on track to be living in a sacrifice zone here, and pollution from the gas hub is going to result in catastrophic health impacts for our community, from breathing difficulties to increased rates of blood cancers, stillbirths, birth complications. This is unacceptable, and it is reprehensible that the health consequences of these sorts of projects are not being spoken about by either of our major parties. In government, we have an obligation to inform community about the impacts of these projects.
Thanks very much, Phil, and thanks for sticking to time again. So we've gone through our first question now, we're on to our second question. So the second question is, what strategies will you implement to reduce preventable chronic diseases and the unacceptable health gap between First Nations people and non-Indigenous people? Over to you, Ben.
The core of the matter is, for myself, is childhood poverty. It is unacceptable, the levels of the amount of people, particularly children who are living below the poverty line. This has to be addressed urgently. Almost half of the people living below the poverty line are Indigenous. They are disproportionately represented in this dire statistic. We need to focus on the core issues, that is more homes, crisis accommodation, youth centres, safe places where young, vulnerable individuals can get access to meals, have a shower, safe place to sleep, maybe play some Xbox, get them off the streets. The returns to government are substantial. If we prioritise such measures, we can take money out of the criminal justice system, for example, and redirect that to preventative health and health measures. We need to improve access to affordable and healthy produce. The price of fresh produce, particularly in our regional communities, is outrageous. The supermarkets are gouging the prices of food, affecting Territorians and their ability to choose between healthy items on the supermarket shelf and items that are unhealthy. We need to reform the criminal justice system. We need to keep kids out of jail. We need to empower them and show them an alternative path. Locking kids up at over $3,000 a day is not the best solution. We have to focus on preventing them into entering the criminal justice system and empower these young men and women to be engaging in our society. We need to incentivise people to study in the Northern Territory, whether they're local or international. We need to help them, bring them here to address urgent health matter concerns. Thank you.
Thanks very much, Ben, and welcome Lisa Bayliss, the candidate for the CLP. Just to bring you up to speed where things are up to, we're on the second question today around what strategies will you implement to reduce preventable chronic diseases and the unacceptable health gap between First Nations people and non-Indigenous people. we're heading down the line, so we've got a bit of time. But Luke, up to you now to respond to that question. Thank you.
Yeah, I just want to shout that answer out in terms of it is about prevention. It's about youth engagement hubs. We've funded it, waiting for the NT government to build. Let's hope they do build in the northern suburbs. But when it comes to our Indigenous communities, not only have I worked in that space, but I want to give a shout out to Malandiri McCarthy, the Minister for First Nations, and Marion Scrimgeour, who are doing a heap of work in this area. And should be applauded for that. And it's about jobs out in the community, doubling ranges, getting people working out on countries. It's about investing in community-controlled organisations, working with the peak bodies. We're doing all of that. But we do listen to evidence and make evidence-based decisions, and we listen to experts, and First Nations people happen to be the experts on their communities, listen to people with lived experience working in the communities and for the communities. That's who we work with and listen to. What's the alternative? We all remember the intervention and that sort of heavy-handed paternalistic downwards facing. We even hear it from their own members, the members of the CLP working at a federal level, talking down. And I think that is really unfortunate and just does not work. There is a focus on throwing kids in jail instead of helping, and as the acting police commissioner said the other day, working on the drivers of crime. So we're helping with policing, for example, but we're also working on the drivers of crime, because the drivers of crime is where we want to support kids, whether it be fee-free TAFE, whether it be more funding into early childhood centres, more funding into our public schools. All of that matters. It matters deeply. And having job opportunities. So there's hope for the future. That is our focus. And the alternative is pretty dire.
Okay, thanks very much. Luke. Jonathan, now over to you.
This is a two-pronged question. What are the Greens proposing to do about preventative chronic health issues? As I said at the beginning, we want GPs to be free for everyone so that you're not clogging emergency service for something you could have addressed months prior. We want to put dental and mental into Medicare because dental health is preventative health. We also want, where our policy is for free school lunches for kids in schools so that parents have one less thing to worry about and kids have a full belly so that they can actually learn. In terms of the unacceptable chasm between health outcomes between First Nations Australians and non-Indigenous Australians, that's a national disgrace. It is a national disgrace, and it starts with truth and it starts with respect. I know from my background that community organisations get piecemeal funding, or when they get their funding, they have to go back to the hand that feeds and constantly ask for more and constantly resell the same story over and over because successive governments don't invest in these programs in a long-term capacity. The Greens have a policy to put $750 million towards Aboriginal community-controlled health organisations for advancing policies and programs in line with the National Agreement on Closing the Gap. The outcomes at this moment, if the government was serious about closing the gap, they would actually do something. They wouldn't just keep talking about it. And that's why there needs to be genuine action in preventative health. As I said, free GPs for everyone, dental and mental into Medicare, free school lunches for kids in public schools, and making supermarket price gouging illegal so that you're not choosing between paying your rent and going to the doctor.
Thank you very much, Jonathan, again for staying to time. We'll now move to Phil Scott, and just to remind people, what strategies will you implement to reduce preventable chronic diseases and the unacceptable health gap between First Nations people and non-Indigenous people?
Thanks, James. Preventable chronic disease. Territorians have higher levels of chronic disease and less access to preventive and primary healthcare services than other Australians. The top end needs more health staff and support workers to provide these services. Most chronic diseases can be prevented by not smoking, eating well, being active, and reducing alcohol intake. But there are significant structural drivers, such as these social determinants of health, that are driving this chronic disease, particularly in First Nations people. I'll advocate for needs-based funding and support for all health services, including promotion and prevention programs. I'll support a national health prevention funding agreement with the states that implements evidence-based prevention reforms overseen by the Australian Centre for Disease Control, which I understand the CLP party have said that they will defund. I'll back our vital Aboriginal community-controlled health organisation, Danila Delwa, to lead the delivery of health services and broad wellbeing programs, including violence prevention, to close the gap. I'll fight to extend Aboriginal community-controlled health services who have a track record in providing comprehensive primary health care that achieves better results, employing more Aboriginal people, and are typically preferred by Aboriginal and Torres Strait Islander people over mainstream services. I'm also committed to achieving Closing the Gap Priority Reform 1, empowering local First Nations communities to drive decision-making, providing support to community-controlled organisations to meet challenges and grow stronger, and advocating for First Nations self-determination as the ultimate goal. This includes not just investing dollars, but also investing in capacity building and governance support for these organisations, so we are setting them up for success, not failure.
Thank you very much, Phil. And we will now hand over to you, Lisa, for that question. What strategies will you implement to reduce preventable chronic diseases and the unacceptable health gap between First Nations people and non-Indigenous people? Thank you.
Nice, thank you. And look, apologies, I was running late this morning. There's been a number of announcements we've already made around the Territory Health. We're looking at putting in another urgent care clinic in Darwin, so we've matched that commitment, but also in mental health as well. We've increased funding for Headspace, and also we've also made a commitment in a aged care facility as well. So I think, and all those things will free up bed space at the hospital, particularly around the aged care. Look, a Dutton government will provide an outcomes-based solutions to improve Indigenous Australians. And where possible, we like to use local providers and provide that to the community. But I think the really important thing here is outcomes-based. And we've had far too long. I've spent my whole life here in the Territory. I've spent a lot of times in Indigenous communities, and I've seen the type of health outcomes that we've had. We've now had 3 years with federal Labor. We had 8 years under the Territory government, and we have seen, closing the gap. The gap's been getting wider. So what we're doing is clearly we've got a huge issue with Indigenous Australians, and where possible, we like to have Indigenous healthcare workers to provide those services to the community, but at the same time, it's about outcomes based. So where that's not been met, we need to actually look and see what programs are working, and the ones that aren't working, we redirect that funding. So yeah.
Okay, thank you very much, Lisa. We will now go to the next two questions, are both relating to cost of living pressures. We've dedicated 2 minutes to each of these questions, and so the first question will be, what will you do to ensure affordable, healthy food? The second question will be, what structural changes do you propose to improve access to quality, stable and affordable housing? So one relating to food security, the other relating to affordable housing. But we're going to start with that first question. What will you do to ensure affordable, healthy food? And I will now hand it over to Ben to start us off.
Access to affordable, healthy food is a cost of living issue. It's a pressing issue. My party proposes that we reduce the cost of fuel by 26 cents and power bills by 20%. This will decrease the cost of transporting produce to the Northern Territory, allowing Territorian parents to feed their children at a reasonable cost without opting for ultra-processed foods, which are considerably cheaper than the alternative being fresh produce. In regards to housing, we propose that we remove GST off materials for building to allow Territorians to build or own a house, making it more affordable, but we want to see a reduction in immigration to alleviate housing pressures to allow Territorian families access to their right, and that is for a safe house to live under. I have questions in regards to lobbying in politics, particularly food companies. I don't see why politicians should be accepting money, or their parties should be accepting money from food lobbyists. It is a compromise. It must be stamped out. And I don't understand, for example, why in Darwin we see a proliferation of fast food outlets. We need more access to fresh fruit and produce, not fast food. We know this food is damaging. We know that their advertising is targeting our children with addictive foods. This must end. We can't allow our children to be preyed upon like this. Thank you.
Thanks very much. Thanks very much, Ben. Luke, over to you.
Yeah, the key is education around nutrition, and one of the things as part of the the remote food security strategy has been, and there was heaps of consultation with this, there was over 20 sessions with communities to talk about how do we make the food that is being consumed out in remote communities, but in our whole community in the Northern Territory, more nutritious. First thing, consultation. Second thing, working with experts. There's been 30 food types that this strategy will make cheaper, important food types for health and nutrition, but a lot more capacity building in our remote stores as well. Some of you would know that I've been in talks with Aldi about having a presence up here. That is linked to food security out in the communities. So not only have we got a big enough population up in the top end here for several Aldi stores, but it's about using our distribution links. We've committed 440 million to logistics hubs up the highway and our road system as well. So some of the price pressures on the cost of good food out in the community stores is related to the road system and the wear and tear on trucks and that sort of stuff. Part of it is governance and training of the people who actually work at the stores, and some of it is about making the good food cheaper, and 30 items have been selected for that purpose, for making good nutritious food cheaper and more available and obviously more affordable. I think that's a key part of our strategy, and we'll keep going on that strategy because we know that that is an incredible social determinant of health outcomes in our communities.
Thanks very much, Luke. Now over to you, Jonathan. What will you and the Greens do to ensure affordable, healthy food?
We're talking about household budgets. So affordable, healthy food, going to the GP for free will have a huge impact on whether or not you're able to feed your family. That, plus putting dental and mental into Medicare, means that going to the dentist without having to pay through the nose means that you'll be able to feed your family. Free school lunches for public school children means that parents don't have to worry about what food is going to go into their children's bellies so that they can learn. That's one less thing to worry about, and it's all completely achievable, and the only reason that it isn't being done is because of a lack of political will in the two major parties. We have policies to make price gouging in supermarkets illegal, because we know that supermarkets are posting record profits, and that comes off the backs of everyday Australians who otherwise can't afford a full shopping cart. I'm going to talk about housing in a minute because we know that all of these things are connected. Health outcomes, housing, healthy food, going to the doctor are all things that will prevent chronic health issues that we're seeing. So in terms of making healthy food more accessible, all of the things that I've said, going to the GP for free, getting dental and mental into Medicare, and free school lunches, and making price gouging illegal in the supermarkets.
Okay, thanks very much, Jonathan. Phil, over to you. What will you do to ensure affordable, healthy food?
To quantify one of the reasons why we have such unaffordable food here, Coles and Woolworths control 2/3 of grocery sales in Australia, and their combined profits exceeded $1 billion last year. They also happen to donate to the major political parties. This is a direct outcome, the cost of living is a direct outcome of inaction of these governments, allowing a corporate duopoly to dominate our grocery markets, as a political duopoly dominates Australia's politic. Long transport distances, high operating expenses, and weather extremes also result in higher food prices for us up here in Solomon. So I'm advocating for greater support for remote community-owned stores. I'll push the government to tackle the cost drivers of this rather than just, once again, address the symptoms. That includes corporate profiteering and greater regulation around that. Breaking up the supermarket duopoly and tax reform so that these two corporations selling us our groceries are paying a little bit more than 1% tax every year. Further, increasing the power of regulators to stop companies from overcharging and boosting funding and enforcement powers for them to undertake greater surveillance and higher penalties for price gouging is a part of that.
Okay. Thank you very much, Phil. Lisa, over to you. What will you and the CLP do to ensure affordable, healthy food?
Well, look, I think this is not just a Solomon issue. This is a whole territory issue. Our vast distances, our road networks, our road infrastructure, transport infrastructure, it's subject to weather. So every year we have our monsoonal air comes and destroys the road. So access to communities is costly. And it's often expensive to get trucks to places where they need to get to. And unfortunately, then there's the choice within the communities. It is lacking, and I think this is something it's also in the community within Darwin. I go to the grocery store like anyone, and our fresh produce is no longer fresh. It's already gone sort of outdated. It's frustrating, and I've grown up with it my whole life. And I think that it's the distance, but it's the cost is the big thing. And one of the commitments we've made is around halving the fuel tax excise, which will help with the cost of transport for the first 12 months in government. And if we need to, we'll extend that further. But I think probably, for the community to know, this problem is not. It's just not easy to say. And when we hear comments made like these companies are only paying 1% tax. We know that's not true. These companies are not paying 1% tax, but there is an issue with our duopoly. There is a duopoly in Australia, well, particularly the top end. Having LD come to Darwin, that would be wonderful, but unfortunately they're not coming. We need our population to grow, and how I see it is, in order for our population to grow, we actually need to look at the reasons why people are not coming to the top end, and it's around crime. We need to fix crime, and we need to make sure that people want to come here. And I speak to businesses when they Google things like, coming and moving to the top end. It's expensive, but also things like airfares, but also crime. So I think that's really important to make sure we address that.
Okay, thank you very much on that, Lisa. We're now going to the second part of that cost of living question, which was around what structural changes do you propose to improve access to quality, stable and affordable housing for all? I really want to emphasise the structural changes there, because that was really prominent in the questions that came forward from the people here. So I will hand it over to you, Ben, to start us off.
Like I said before, housing is a human right. Like everything else in this country, it has been commodified. It's unfair that young people do not have the opportunity, like our parents and grandparents did, to buy their first home. And people who are unable to purchase a home should be within the safety net of this rich, great country. Us as taxpayers need to prioritise that children, especially, have access to safe places to sleep. We want to see more focus on building more houses, culturally appropriate houses, houses which reflect the needs of the people that require them. Unfortunately, it's very expensive to build in regional parts of Australia, particularly the Northern Territory. I'd like to see, like I said before, a scrapping of the GST on building supplies to make it more affordable to build in these regional areas, but also reduce the cost of electricity and fuel. We can do this. We know what to do. We need to say it as it is. We have major problems with our housing market and accessibility, and there's no reason why a child should be sleeping out in the street or someone sleeping in a friend's garage. It's unacceptable in today's society. We're the richest country in the world. We can do better.
Thank you. And Luke, over to you. What structural changes do you and the Labor Party propose to improve access to quality, stable and affordable housing for all?
Yeah, it's a good question. And why are we where we are, whether it be in health outcomes for Indigenous people, whether it be housing situation, whether it be a pro-investor model, because we had 10 years of a coalition government. Kind of don't forget that, 10 years of a coalition government, you know, Abbott, Turnbull, Morrison, a lot of damage was done. What are we doing structurally? Housing Australia Future Fund. So billions and billions of dollars in a sustainable, ongoing channel of funding into 55,000 affordable and social houses. 28,000 of those are on the way, as in the process of being built, including here in Darwin and Palmerston. We've funded domestic violence shelters. I've put up $3.5 million for veteran-supported accommodation for first responders as well, who are at risk of homelessness. But that DV refuge space, I'm particularly proud of our focus on making more of those homes more affordable. When you've got a Prime Minister who grew up in public housing, it's no surprise, I suppose, that we want everyone to have the ability to be in a house, because that's so important for the social determinants of health, but also the likelihood of getting a job and having a happy and fulfilling life. Right, but no one gets left behind is about a 45% increase in rental assistance. That's what we've done, federal Labor, 45% increase, so that the people who really need a hand to stay in a house have got that support. But the other piece is workforce. Now, what we're doing with free TAFE, right, that the coalition have said that they'll get rid of free TAFE. What free TAFE does is make sure you've got the people to build all the houses we need in this country. We've also got a $10,000 incentive for people to see through their apprenticeship so that they can build the houses around the country that we need. When it comes to the territory and remote communities, as I've mentioned, we've got a $4 billion, that's with a B, plan with the NT government to build houses for our remote communities, so they'll have better life outcomes as well. Thank you.
Thanks very much, Luke. Jonathan, now over to you. Again, the question, what structural changes do you propose to improve access to quality, stable and affordable housing for all?
Thanks, James. In terms of a structural change, government has a role to play in the creation and generation, the making of public and social housing. The Greens are proposing a national public developer so that houses are actually built and delivered. We're not just talking about numbers that are being made up on the fly. We want to cap rental increases at 2% every 2 years so that renters have certainty about how much rent they're going to pay and can budget accordingly. We want to introduce low-cost mortgage options capped at 1% above the cash rate so that families don't have to choose between keeping their rent over their head, paying their mortgages, and going to the doctor. There's that free GPs policy again. And we also want to make it easier for first home buyers to enter into the property market by removing the capital gains tax concessions and negative gearing so that wealthy property investors aren't buying their 11th home while families struggle to keep a roof over their head. This election, or rather the major parties want to give away $180 million over the next 10 years to wealthy property investors through negative gearing and capital gains tax. We say that money should be better spent on building more public and social housing.
Okay. Thanks very much for that response. Phil, over to you. Again, as an independent, what structural changes do you propose to improve access to quality, stable and affordable housing for all?
Thank you. We do need a massive reset on housing. We are where we are today, not just because of 3 years of one particular government, but decades of neglect and actions and decisions and indecisions that have housing so expensive. As Ben pointed out to his credit, housing is a human right, and yet it has become an investment. I'll push for immediate increases to Commonwealth rent assistance, youth allowance, job seeker and disability income support payments. Increasing the total amount of housing in in the Housing Australia Future Fund, and suggest that we could pay for some of that by taxing some of the companies who are currently dodging their tax, such as Impex, to draw on our earlier question, who made $20 billion last year and paid zero tax. We do need to address the supply issue in housing. And good quality housing has about 30% social and affordable housing to about 70% private housing in communities. When talking about the social determinants of health, making sure that this housing mix is spread across cities as well also is significant, so that we don't have areas of poverty and disadvantage concentrated in particular places. We need to look at mechanisms such as bringing down the cost of construction, education pathways for skills needed to build homes, increasing supply and a wider range of housing options. Increasing renters' rights and protections is needed, and I'll work with the NT Government to progress this and support the establishment of a National Renters Protection Authority and national tenancy standards. And finally, addressing the root causes of crime, such as rough sleeping, alcohol abuse, housing stress, social isolation, and intergenerational trauma.
We'll bring it to a close there, because I think we're at time now.
Thank you.
Thanks. Lisa, for you, from a CLP perspective, what structural changes do you propose to improve access to quality, stable and affordable housing?
Yeah, look, I think home ownership is it's one of those things that in the past people have aspired to, and it's become out of the reach of most ordinary Australians, which is, it's a tragedy, because it should be, home ownership should be something that we all aspire to. And that's one of the commitments that the Coalition have made around giving access to people's super, so they can use that as a deposit for their home. The Territory Government's also committed to releasing $50,000 for first-time home buyers. So in terms of access to home ownership in the Territory, I think we still currently have one of the most affordable places to buy houses, but it is concerning that we've had a lot of people come in from overseas and we don't have enough houses for them all. That has artificially pushed up the cost of housing, and I think the Territory's we've been a little bit luckier here. We've escaped the majority of that, but definitely down south in Sydney and in Melbourne, those house prices have become just out of like over $1 million for just an ordinary basic house, and that's ridiculous for anyone who's trying to start in today's salaries. So particularly around that, we've also looking at the Coalition have announced around 650,000 as a cap for people who are first home buyers to be able to access their mortgage repayments will be tax deductible. So I think that will definitely help first home buyers get in the market as well. With, just on negative gearing as well, that's one of the things that the Coalition are committed to. The majority of people who do negative gearing, they're just, mum and dad investors that have got an extra house that they want to save for their retirement. And that kind of stuff, it makes a huge impact for them, saving for their future. There's a lot of sacrifice that goes into for all those things that people do. But I think it's really important that we still have that home ownership dream that we're able to keep alive.
Okay,
I'm happy to address that.
We're going to hold questions for the moment. We've got to stick to that. If that's okay, Natalie, if we've got time at the end, we may come back to that opportunity. So we do have this final question, and just a reminder to all of the candidates, you've got this opportunity after we've run through this question to then ask one other candidate a question. You've got 30 seconds to ask that. They've got 30 seconds to respond. So if you don't have something prepared yet, please think about it while we're going through this one as well. So the next question, Australians lost more than $11.5 billion to poker machines in pubs and clubs across 5 states in 2021. Polling shows that Australians want action to rein in the gambling industry. What is your position on the you win some, you lose more report, and will you implement the report's recommendations? Ben, over to you.
I absolutely detest pokie machines. I think they're a scourge on our society. They affect the most vulnerable people, and the flow-on consequences of them being on here far outweigh the positives of them being in our society. I will support the report's recommendations to reduce gambling harm. I would like us to look into lobbying. Are these companies lobbying our governments, and is it affecting their policy and decision making? It's important that we protect children from the harms of gambling. Poker machines, if it was a perfect world, I would love to see them abolished altogether, but I know Territorians don't mind having a slap, so I accept that, you know, you have your freedom of choice, but we all know that they do affect our most vulnerable people the most. You only have to go into one of our local licensed venues at 1 o'clock in the morning to see parents playing the pokies. We know that they've probably got children at home. They should be at home with their kids. It's unfair. It's really sad, and I really want to make a difference on this. We can do a lot better. Let's end the scourge of gambling on our society and look at the advertisements and the lobbying. Thank you.
Thanks very much, Ben. Luke, what is your position, or that of the Labor Party's, on the "you win some, you lose more" report, and will you implement the report's recommendations?
Yeah, that's obviously was our government's member. She's gone to God now, Peter Murphy, but she was the chair of that report, and she did a wonderful job on it. 31 recommendations, and we've consulted widely since then. But rather than say what is obvious, is that it's an incredible concern to all right-thinking, reasonable people, the damage that's been done by gambling. And there is more to do, and the Prime Minister's made that clear as of 2 days ago. He reiterating that there is more to come from us. But I think it's worth talking about what we've already done, what is in place already. We've implemented monthly activity statements, so Australians who gamble online can clearly see their wins and their losses each month. I think that is important. We've required all staff working in online gambling to have appropriate training to create safer wagering. I think that's important too. It's no different to RSA, where someone serving alcohol is taught the responsible service of alcohol, so that training is important. We've introduced new evidence-based taglines about the risks of online gambling, but we've also legislated a ban on the use of credit cards for online wagering, because people shouldn't be betting with money that they don't have. So we got rid of wagering with credit cards. So we're closely considering all the 31 recommendations. The Prime Minister has said that we'll have more to do. Like a lot of people, I grew up in a community where I saw the damage caused to families. Even in our community here, I've seen the damage done to families where, one of the members of the family sort of blown the whole family's money, and it destroys lives. And that's why we'll take further action.
Thanks very much, Luke. Jonathan, over to you. What is your position on the "you win some, you lose more" report, and will you implement the report's recommendations?
Thanks, James. Yes, having read the recommendations, I can say the Greens policy cuts across those recommendations. We want a national independent gambling regulator to work with the states and territories to stamp out this horrible scourge on society. We need to urgently ban all gambling advertising across TV, radio, online, including gaming. Peter Murphy, rest in peace, was absolutely right, and experts and the evidence are clear that gambling ads do significant damage and must be banned immediately, just like tobacco ads. Just 2 days ago, we learned that the Prime Minister personally intervened to protect the gambling lobby and not ban gambling advertising. We need to end the grip of the gambling industry by banning donations to political parties from this harmful industry, as well as other industries, including the coal and gas industry, and that's what the Greens are proposing to do at this next election. Experts are saying we're heading towards a minority government, and the Greens in balance of power can make a difference and make Labor act.
Thank you very much, Jonathan. And Phil, what is your position on the you win some, you lose more report, and will you implement the report's recommendations?
To answer the question in one word, yes. To answer it in 3 words, yes, I will. Sport is a core part of Australian culture. I play rugby and coach a local rugby team. And yet, watching live sport is awash with gambling ads, which are harmful to our communities. It is offensive that my children are as exposed as they are to these ads every 90 seconds on Australian television. We have the highest gambling losses in the world here in Australia. Pokies and online betting are particularly addictive and harmful, leading to serious harm for hundreds of thousands of Australians. What our community is finding so frustrating is that these reports are done in good faith by experts who understand the health implications of these sorts of industries, with recommendations made on what good public policy ought to look like. And yet, so often, these reports are ignored, there's obfuscation, there's kicking the can down the road, and there's an abject refusal to take expert advice on what is in the public interest. We need to do better. Our decision makers in Parliament need to do better and really need to value experts in ways that we simply do not do. So I propose that companies with combined gambling and alcohol interests and their lobby groups contribute. The ban on gambling advertising will help push back the persistent online grooming of our young people and the danger of addiction that can ruin their lives. I also support legislation which enables a phased, comprehensive ban on online gambling advertising within 3 years, as recommended, and will advocate for funding to be allocated to implement all the other recommendations in full.
Thank you very much, and again, staying on time, appreciated. Lisa, last one for this question. What is your position on the you win some, you lose more report, and will you implement the report's recommendations?
Yes, the Coalition supports the Peter Murphy report and recommendations, and also in relation to online gambling online, they've already committed to banning it, the advertising before games and during games.
Lovely, thank you. We will now move on to the questions that each candidate has of another candidate. Again, remember, no more than 30 seconds in terms of the question you ask, no more than 30 seconds with your response. Ben, you're free to ask a question of another candidate.
Is there something on my lip? I'd like to ask Mr. Gosling about gambling companies lobbying and donating to the major parties, and if that influences their policy and decision making.
No. That's the response? No? Yep. 30 seconds, Luke.
Jonathan,
Yes, Luke.
why are the Greens so unambitious when it comes to a renewable energy future powered here in the Northern Territory? Now, what we're doing is large-scale batteries to underpin a system where we take Territory sunshine,
Microphone, please, Luke.
where we use Territory sunshine, turn it into electrons that power the stuff that we need for a net zero future, the critical minerals processing.
That's your 30 seconds.
Making batteries. Why?
Well, I might attack.
Go, Jonathan.
I might attack the premise of that question in terms of Greens' ambition. I think it's a bit rich asking a question like that when you want to put $1.5 billion towards a dirty petrochemical plant in Middle Arm. My question? Is my question?
It's your question now. Yes, thank you.
Things that make net zero happen.
Hold on. Here we go. Luke Gosling. If you're re-elected, will you put dental into Medicare?
Have you already finished saying how unambitious you are? Wow, that's amazing. For the record, no answer from the Greens about why they've got such a lack of ambition on renewables. But it's a shame, right? Because all of the precursors to a net zero future is what we are going to fund. So what was it? What?
Dental.
Yeah, okay. dental. No.
That's 20 seconds gone, Luke. 10 seconds to go.
See, look, we understand. Can I just? You're eating up my time here. Dental. Oral health is very important. Women's health is very important, which is why I brought an endometriosis and pelvic pain clinic to Darwin.
I think it's
Lovely.
Men's health.
Okay, Luke. Next, wait a second.
Men's health.
No heckling. Can we allow the others, please, to ask their questions first?
Thanks, James.
Okay, Phil.
My question is for Luke. The Darwin region had the worst air quality of all major cities in Australia, and the Middle Arm project, with its plans for gas and petrochemical processing, will worsen this. Will a Labor government commit to measuring and limiting emissions of hazardous and cancer-causing pollutants from industry at Middle Arm?
This is a classic example of the lack of integrity in the arguments around this fella and the Greens, right? So just think about this. Why is air pollution bad in the Territory? It's because of burning grasses, wildfires. That's what causes, the burn when your people can't go outside because of the smoke in the air, right? So what they're trying to say is that nothing good is going to happen at Middle Arm. It happens to be essential for a net zero future. So...
And that's the 30 seconds, Luke. Sorry.
I reckon next time we need...
And you reckon a minute next time. Noted. I'll let them know. Lisa.
Doesn't take a minute to say yes or no.
Your question, Lisa.
I've not prepared a question, and so my apologies. It was not given to me in my brief, what I had to do this morning. I'll throw one to Luke again. We're picking on Luke this morning, so I'll throw another one. Luke, why haven't you been able to address the, it's not really a health question, but why haven't you been able to address the cabotage in the Territory?
You're right, it's got absolutely nothing to do with health, but it does go to livability. Right, for a year I've been saying that a federal Labor government will give a pilot to Darwin should there be an international airline that wants to engage. But the fact that that question to the sitting member has come up just reeks of the political opportunism and the lack of understanding about health and what public health really is. But livability is important, which is why we've put money into public pools, which is why we've put money into youth engagement hubs. I mean, and livability
Luke,
is
we've got to wrap
important.
it up there. Thank you.
Well,
Perhaps I agree with you, maybe 1 minute next time, but we will see. And what we're going to do now is we're going to allow 1 minute to do a quick sum up for each of you, and then we are going to wrap up the session. My understanding is, I'm told, and I do know because I've received lots of messages from people online with questions here to my phone. I do know that there are questions from the audience. We respectfully request that you hold those until after we've finished these questions to catch up with the candidates if they've got time immediately afterwards. But Ben, do you have any final words that you wanted to say? 1 minute max.
The last 40 years of the major parties hasn't worked out well for us. We need to send a message to Canberra that we are unhappy with the direction of our country. And particularly, we need to have our children empowered to be optimistic about the future, to be proud of where they're from and who they are. We need to make sure that the big corporations in this country are paying the taxes and the royalties that they need to fund a raft of measures, whether that is housing, preventative health, and services that everyday Australians need and rely upon, and this must be affordable and accessible. We want to see domestic manufacturing brought back to Australia. There's a great link between employment and positive health outcomes. We need to incentivise training of our doctors, nurses and healthcare professionals. Thank you.
Thanks very much, Ben. Luke, your 1 minute.
Yep, well done, Ben, and I'll just pick up where you left off. So what I've got a commitment from our government is a CDU medical school. We're going to train more Territorians as doctors, more Territorians as nurses, allied health professionals, Aboriginal health workers. I've got a particular passion around men's health as well, and we'll have more to say about that in the future. But if you have a look at our track record, not only when in preventative health during the Rudd-Gillard years, then we had 10 years almost of governments which basically ripped the guts. Well, Peter Dutton was the health minister, voted the worst health minister ever by doctors, ripped $50 billion out of health budgets. That's the alternative. So we've got Peter Dutton, we've got Phil Scott, we've got Adam Bant, and we've got Albo as our leader, and Pauline Hanson here. So I think what's important is, and I don't mean no disrespect, but we are part of.
Time is
we
up,
are
Luke.
part of parties that make a difference. So just think about that when you vote.
Thank you. Jonathan.
I'm going to be saying these policies until I'm green in the face. The Greens have policies to make going to the GP free, putting dental and mental into Medicare, free school lunches for public school children, and making supermarket price gouging illegal. These are policies that will help with preventative health issues, as well as housing, because everyone should have a roof over their head and shouldn't have to choose between going to the doctor and paying their rent or their mortgage. The Greens and the balance of power can make Labor act on these issues, and I think Solomon is ready for a change. Thank you.
Thank you very much, Jonathan. Phil.
Thank you. I am sitting here today because our community has come to the realisation that we have all the knowledge, all the expertise, all the skills and all the wherewithal to be able to understand what our problems are, certainly know the solutions, and we now have the will and the capacity to take an agenda to Canberra to properly represent ourselves and make sure that needs-based funding for Territorians is applied, to make sure that subject matter expertise is respected and acknowledged, to make sure that self-determination for First Nations people and our community is prioritised and valued and advanced by our representatives. The lens we will take to decision making includes principles of equity and justice, making sure that every bill is assessed against those sorts of principles, making sure that a do no harm principle is applied to our decision making, and we are committing to doing that as the community of Darwin and Palmerston.
Okay, thank you very much. And Lisa, a 1 minute summary from you.
Yeah, look, and the reason I brought up cabotage, I'm sort of now going to segue back there, is one of the issues we have is attracting people to the Territory. So I talked about crime, but also the cost of airfares. Coming to the Northern Territory is not an attractive place for many employers and employees because it's expensive. And how do we get people here? We have to make it more affordable. In terms of healthcare, the coalition have committed to increasing, the Medicare as it goes up. Also, we've talked about investing into aged care up here. This is one of those things. We've got 60 beds that are permanently locked up with aged care patients, and that's not a proper place for our ageing Territorians to be. They should be in a proper facility that caters to their needs. And the reason why that's so important, we have 60 beds that are locked up with aged care patients, then we're not able to do operations. We're not able to care for other Territorians, which then puts us on the back foot. So I don't want to see that happening. My parents have retired here. I want to be able to retire here, and I think that's essential for our future.
Okay, thank you very much, Lisa. Listen, that brings today's discussion to a close. I really do want to say a huge thank you to Ben, Luke, Jonathan, Phil and Lisa for coming along today. It's my understanding that this is the first opportunity that they've had to come together as the candidates of Solomon. So I would like to really thank the Public Health Association of Australia, PHAA, for for organising this event. As I said earlier, please do, if you've got questions, come and ask the candidates before they leave. Be respectful of their time. But I do want to thank everybody for a respectful discussion today, for some great questions, some great discussion, and want to hand it back to Marita to close today's event.
Thank you, James.
Thank you so much, everyone. And just a little plug for the Public Health Association. If you're not a member, please consider joining up. We'll continue to put questions to the candidates and a dialogue. And thank you very much, James, for a stellar job moderating today. Thank you, everyone.
After